Wow! There are so many veins, arteries, and capillary in our body. Where can I obtain a blood specimen from the patient? What equipment that I need? Which site should I perform the venipuncture? What is the step that I should follow? Having all of these questions in your mind? Don't worry, my friend and I are here to help you. Let's go! Oh wait, before that, let me explain our main objective for this video. The first one is to identify the potential site for blood sample collection, and the second one is to perform venipuncture. Blood can be collected from 3 different sources: venous, arterial, and capillary. And the most commonly collected and tested are venous specimen.
In these experiments, you will need hand sanitizer, alcohol pads, gloves, disposable syringes and hypodermic needles, or evacuated tube system or wing infusion set, tourniquet, blood collection tube, and lastly, gauze.
So, the procedure is firstly, prepare the equipment and prepare for patient identification. Then, select the venipuncture site. Ask the patient to make a fist. Then, apply a tourniquet 3 to 4 inches above the collecting site. When the vein is selected, cleanse the area in a circular motion, beginning at the site and working outward. Allow the area to air dry. Swiftly insert the needle through the skin into the lumens of the vein. The needle should form a 50 to 30 degree angle with an arm surface. Then, filling the tube. When the last tube is filling, remove the tourniquet. Remove the needle from the patient's arm using a swift backward motion. Place gauze immediately on the puncture site. Apply and hold adequate pressure to avoid formation of a hematoma. After holding pressure for 1 to 2 minutes, tape a fresh piece of gauze or band-aid to the puncture site. Dispose of contaminated materials or supplies in designated container.
The precaution of withdrawing of blood. First, the tourniquet should not be too tight. Applying a tourniquet slows the flow of blood in the veins and increases venous filling, thus making the veins more prominent, easier to look at, and easier to enter. However, leaving the tourniquet on longer than 1 minute may affect the laboratory test results. Second, the blood is never collected from an intravenous line or from the arm being used for intravenous line, since it will dilute the blood sample. Use an alcohol prepared to cleanse the skin around the site in a fluid circular motion. Swipe from the center to the periphery of the site, being careful not to drag the pad back across the cleansed field. Let the area air dry to prevent contamination of either the patient or the specimen. Position the needle so that it forms a 30-degree angle with the surface of the arm with a single short but firm motion. Swiftly insert the needle through the skin and into the vein. Push the evacuated tube onto the needle when the needle enters the vein. As the vein aligns with a needle, blood will begin to move out of the vein up into the needle. As soon as blood begins to flow into the collection tube, instruct the patient to open his hand and remove the tourniquet from his arm. Removing the tourniquet allows the blood to return to its normal rate of flow through the vein and helps reduce bleeding at the puncture site. A gentle mixing by inversion at least 8 times is required to ensure that any additive in the tube are incorporated into the blood sample. Catch the safety device on the needle and use the sharp device for proper disposal. Applying pressure at the needle on 3 sides immediately after removing the needle will prevent a hematoma from forming and allow hemostasis to seal the wound. In this illustration, you can see formation of the platelet plaque and the fibrin clot. Applying pressure at the needle and 3 sides immediately after removing the needle will prevent a hematoma from forming and allow hemostasis to seal the wound. Apply the ID label on the field evacuation tube and store it for transport to the lab. The label must include at least the patient's ID number, full name, date of birth, and today's date. Using standard precautions, dispose of needles in a sharp container. Dispense of all other used non-sharp materials, including used gloves and coarse pads, in an approved trash receptacle, and disinfect all contaminated surface areas. Failure to align the needle perfectly with a vein and failure to insert the needle at a 3-degree angle can result in the needle missing its mark. Inserting the needle at too steep or too shallow an angle and not aligning up precisely with a vein are 2 common reasons for missing the vein. To the patient, that usually means only one thing: further anxiety and discomfort. Can have other consequences as well. Serious complications are most likely to arise when targeting the basilic vein with its close proximity to nerves, which can be permanently damaged, or the brachial artery, which could be nicked. Even with a proper angle, the appropriate needle size must be used ready. Failure to apply pressure on the puncture site immediately following removal of the needle can cause bleeding from the vein into the space around it, forming a hematoma, a collection of blood under the skin surface that will become bruised in appearance and painful to the touch. However, in a routine venipuncture, a light blue tube should be drawn first, followed by a red top, gold, green, lavender, and grey.
Order of draw is the recommended sequence in which blood specimens should be drawn to minimize interference in testing caused by carryover of additive in tubes. I will share the correct order of draw right after this. Stay tuned! The first tube is blood culture tube. This tube normally comes with yellow cap or colorless cap tube. This tube contains sodium polyanethyl sulfonate as additive. This tube is used for blood culture specimens, HLA phenotyping, and for conducting parental tests. The next order is blue citrate tube. This tube comes with light blue cap. The blue citrate tube contains 2 additives, which are sodium citrate and CTAD. The additive act as anticoagulant. The sample in this tube is used to perform tests such as prothrombin time, partial thromboplastin time, and thrombin time. The third order is red serum tube. This tube comes with red-colored cap. Different from others, this red top tube does not contain any additive. The blood sample in this tube can be used for serology and immunohematology tests, such as testing for compatibility. The fourth tube is lithium or sodium heparin tube. This tube normally comes with green top tube. The tube contains additives such as sodium heparin or lithium heparin. The blood sample in this tube can be used for sodium or lithium determination and any type of heparin for blood banking procedures. The fifth order is EDTA tube. These tubes normally comes with purple or lavender top. This tube contains additive named ethylene diamine tetraacetic acid or EDTA that bind calcium ions. The EDTA tubes normally used in hematology testing such as hemoglobin, hematocrit, white blood cell, red blood cell, and platelet count. The last tube is gray fluoride oxalate tube. Normally, this tube comes with gray top tube. This tube contains additives such as potassium oxalate and sodium fluoride. Generally, the blood sample in this tube are used to test glucose level, lactate, bicarbonate, and blood alcohol level. Why we need to follow this order of draw? This is because to avoid cross-contamination. So, the blood must be drawn and collected in tubes in a specific order.
As we know, blood specimens are obtained through venipuncture, finger stick, and heel stick. Venipuncture is the collection of blood from a vein which is usually done for laboratory testing. The blood is normally drawn from a vein on the top of the hand or from the inside of the elbow. Finger stick is a procedure in which a finger is pricked with a lancet to obtain a small quantity of capillary blood for testing, also called a finger prick. Heel stick, a simple procedure in which a newborn baby's heel is pricked and then a small amount of the blood is collected, usually with a narrow gauge glass tube or a filter paper. There are a few things that are important during blood withdrawal collection procedure. First, identify the study patient. Patients should identify themselves to the phlebotomist by spelling their show name and stating their birth date. Having a patient respond to a name is not a substitute for a strict patient identification procedure. The misidentification of a patient and thus the patient specimen can lead to patient, physician, and staff confusion, delays in patient disposition, resampling and reanalysis, and even misdiagnosis and therapeutic misadventures. Legally, error in sample identification are indefensible. Second common problem is angle insertion of the needle. Angle exceeding 30 degrees increase the risk that the needle will pass through the vein and cause damage to underlying structures. 15 to 30 degrees the recommended angle of entry. A slightly smaller angle is preferred, however. This would result in a greater chance of the needle pushing through a venous valve and increasing patient discomfort. We also need to disinfecting the puncture site with 70% isopropyl alcohol that decreases the incidence of inoculation with normal skin flora. Disinfecting the skin is especially important when drawing blood from immunocompromised patients, as a patient's immunological status is often unknown to the phlebotomist. The puncture site of every patient should be disinfected appropriately. Most blood drawing SOPs require application of disinfectant in a circular motion moving outwards. Next, the recommended height of the tourniquet is 3 to 5 inches above the intended site. The physical discomfort of the blood draw is decreased, and appropriate anchoring of the vein and stabilization and minimal handling of the needle holder and blood tubes. Immediate mixing of tubes containing blood and anticoagulant will minimize the number of poorly clotted specimens. The study showed that a 3-minute delay before inverting the blood tubes did not accelerate coagulation or fibrinolysis. In fact, 2 inversions immediately after blood drawing produced the same result. It would be interesting to determine whether similar finding would be obtained with EDTA anticoagulated blood tubes and plasma separator tubes.
The purple top bottle is used for hematology tests. The most common of these is the full blood count. This includes hemoglobin, which is an important investigation in numerous scenarios, including blood loss. Platelets, which if depleted can result in increased bleeding risk. And white cell count, which is typically increased in infection. The purple bottle is also used for other tests, including HbA1c, which is important in the assessment of diabetic blood sugar. The gold top bottle is used for a range of biochemistry tests, including urea and electrolytes. This gives values for sodium, potassium, urea and creatinine, used for assessing kidney function and detecting electrolyte derangement, for example hyperkalemia. Other tests include liver function tests, C-reactive protein, bone profile, magnesium, lipids, thyroid function tests and cardiac enzymes. The same bottle is also used for various more specialist endocrinology, oncology, toxicology, virology, and the blue bottle is for hematology tests to assess the clotting system. Coagulation screen includes prothrombin time, activated partial thromboplastin time, and fibrinogen. INR is important for monitoring warfarin therapy, and D-dimers are useful in the diagnosis of deep vein thrombosis and pulmonary emboli. Pink bottle is used to send a blood sample to the transfusion lab for patients who may require a blood transfusion. Group and save or cross-match can be requested. Group and save determines and stores the patient's blood group, so blood can be ordered swiftly if needed. Cross-match refers to the process of ordering blood for the patient. Typically, the bottle must be labelled by hand at the patient's bedside after confirming the patient's details, but your trust will have specific guidelines which you should adhere. The grey top bottle is used for 2 specific biochemistry tests: glucose, which can be a fasting or a random value, and lactate, which can be raised in any condition causing tissue hypoperfusion, for example sepsis or acute ischemia.